So hello everyone, and welcome to a new series that we're offering this fall, focused on how issues of the body and the mind have affected the lives of artists, and how the work of artists can contribute to the healing experience. I'm Curator of Education, Anna Smith, and today we'll begin with a look at the relationship between art and the brain. The programs in this series grew from a desire to examine the intersection of health and creativity, the spark of an idea given to us by Donna Wilhelm, who is generously sponsoring these events, and nurtured by Bonnie Pitman, whose own health issues have driven her to become a leading voice in research and education surrounding the benefits of arts experiences for both medical practitioners and patients. Throughout the series, we'll be working with partner organizations in the field of academia and medicine, presenting perspectives from artists, doctors, and art historians. Joining us today are Dr. James Fleshman, Sparkman Endowed Professor and Chair of the Department of Surgery at Baylor University Medical Center, a part of Baylor's Scott and White Health, Dr. Daniel Krawczyk, Deputy Director of the Center for Brain Health at the University of Texas at Dallas, and of course, Bonnie Pitman, Distinguished Scholar in Residence at the Edith O'Donnell Institute of Art History and Director of Art Brain Innovations at the Center for Brain Health at the University of Texas at Dallas. I'd like to open this series with a passage from Virginia Woolf's On Being Ill, which expresses how difficult it is to accurately capture the feeling of being unwell. A reminder, I think, of why creative practice is such a powerful tool. It becomes strange indeed that illness has not taken its place with love, battle, and jealousy among the prime themes of literature. Novels, one would have thought, would have been devoted to influenza, epic poems to typhoid, odes to pneumonia, lyrics to toothache. Among the drawbacks of illness as matter for literature, there is the poverty of the language. English, which can express the thoughts of Hamlet and the tragedy of Lear, has no words for the shiver and the headache. Please join me now in giving a warm welcome to Bonnie Pitman, who will begin tonight's discussion.
I am so excited to be here tonight with all of you and to launch this series. And I want to express my gratitude first to Donna for helping this project come together with funding, and to Jeremy Strick, who encouraged me to come up with this idea and really bring it to fruition. But mostly Anna, who has been my partner in the months that we pulled the program together. So each evening, what we're planning to do is to have a talk where myself and in the future, the curators here at the Nasher will present some ideas about the artists and how art played a role in, tonight we're seeing an overview of medical history, you know, in less than 20 minutes, so get ready. And then the next one is going to be on physical health, and so there'll be the same kind of a short introduction. And then each panel is each talk, each night, is followed by a discussion by professionals from the Center for Brain Health, the Baylor Hospital, and of course UT Southwestern. So every night it's going to be different. Invited two artists to join us. So it's hopefully going to be a dynamic series and give you new insights about art and healing and resilience. If I had to characterize what's going to be happening, it's about how creative people respond when they become ill. And unfortunately, when I was the director at the DMA, I got a respiratory infection and have struggled for now almost 12 years to be able to, there was a period I couldn't talk, you know, I had no voice at all. I couldn't breathe for large chapters, and I couldn't say more than 3 words without coughing. But thanks to my doctor, Dr. Rosenblatt, I'm able to do all these things now. And I have good days and bad days, but on the good days, like today, it's really powerful to see what is possible against a lot of obstacles. One of my healing places became the Dallas Museum of Art because I know the collection so well, and it was such a rejuvenating place. I also knew that if I got in trouble, I had enough people who knew me that somebody would come to my rescue. So to be perfectly honest, when I start walking again after being sick for a while, it's there in the museum going through the galleries for this very reason, so that I have the comfort of being surrounded by people who know and are willing to help me. So art and healing go together, and we're going to see this. The whole history of medicine is, you guys can't see the slides. Do you want to see? Oh, they can see them there. All right. Sorry. I should see them there. There we go. So it's been a long tradition from, I think the powerful thing is that art and healing has affected the patients in such powerful ways. And this wonderful Buddha is a Buddha of healing over at the DMA, and while you read all the different words, what he has symbolized is that huge calm that comes when you're in the healing practice. And he has a little bottle of medicine that he's holding. So all of the symbols are there in that piece. And what we're basically learning is the importance of taking care of yourself, of the power of art to renew and provide resilience, of all of these different things. Oh, I can read it over here. That's amazing. And Dr. Fleshman may talk about this, that pain medications go down, there are fewer visits to your doctor, and it also lowers depression and anxiety. So there are a lot of medical findings that have occurred to help bring this into fruition. So from the beginning, we as human beings have bled. And so it became very quickly in the Paleolithic art, you begin to see bleeding animals and bleeding warriors with sticks in their hands. And so bacteria and blood have been a source of a lot of the reasons that medicine has been a part of the world that doctors and, of course, patients and artists embrace. In the Paleolithic world, I love, there's the Venus de Milo, Venus of Wildendorf, yeah, and she is just ready. I hate to say this, Anna, she looked like you. Anna had twins last year, and so Anna does not look that way now, but just before that, she did. But it is all about the important role that women play, which is procreation and bringing new life into the world. And next to it is one of the many scenes in Spain of the Paleolithic drawings of the bull, and the bull is, if you saw it, there's a bleeding man underneath him. The first culture where it's recorded that eye surgery was done was the Egyptians, and we see it on the walls and the paintings on the wall. You can see right there the doctor just piercing the eye, and those are some of the medical implements used not only for eye surgery but many other surgeries that the Egyptians performed. So we have these recorded images in their culture. Greece played a very important part in developing all aspects of medicine. And in large part, I hate to tell you, it's because of all the wars they were fighting. And so that constant role of life and death was going on. And many of the doctors in early Greece were women, because the men were off fighting the war, and the women were able to take care of them both on the battlefield and in their homes. There were certainly doctors, as we know, with Hippocrates, but Greece's role in the history of medicine is very important. The human body, everybody loves to look at the human body. And so these are 3 different Asian cultures looking at different anatomies of the body. And you can see one is Ayurvedic, one on the one side I think is Japanese. Yes, I did that right, Japanese, and then you see the Ayurvedic, the points of healing in that medicine, and then second one, Ayurvedic medicine in Tibet. So this just shows you these different healing points or points of reception in the body, and also begins to take the body apart and see the organs inside. So this fascination with what is the medical practice is very high. Andreas Vesalius was one of the great chroniclers of anatomy. He was a 16th century scientist who loved dissections and created volumes of work that are very famous and important at that time. This is another slide about dissections, and of course, which one is Leonardo da Vinci? Anybody can guess? The one on the left, right? So he didn't do anatomical the way you see this whole system on the right. What Leonardo did, is he was trying to solve the problems of making his artworks. And so he did arms and legs and hands and body parts as he needed them for his works of art. And he did dissect cadavers. From throughout history, this is not torture. This is really doctors doing their work. I know in the medieval times there was a lot of torture going on, but this is how they studied together. And you can notice in these next couple of pictures, no masks, no, what do you call them, sanitary equipment. You just cut right in and prayed. That was what you did. And it was very important. And of course, Rembrandt, this was a wonderful commissioned portrait. And so these physicians, which is interesting, they're showing their great work, and they're showing it as they are dissecting a person's body. We know he was a man who was unfortunately a criminal and died, and so now they're taking him apart to use him and learn from him. But this is actually a portrait, and each of those physicians paid to have their faces included and in the portrait, and it then was hung in the Hall of Physicians in Amsterdam. War, regrettably, is a place of great learning for medicine, and I think most people do not know that Winslow Homers was a young man in his early 20s when he entered the Civil War, and he became a chronicler for the Civil War and documented with hundreds and hundreds of drawings, not only the battles, but also what happened in the surgeries. And I did not include some of the gruesome ones, but that was a very important part of his work, and they were all published in Harper magazine. Then, of course, the very famous Gross Clinic, which is Dr. Gross is 70 years old and retiring, and this is his last teaching moment. So he's there doing a dissection, and everybody's looking on. So this picture, the composition is very much focused on him rather than before in the Rembrandt one, where everybody was kind of equally important. Many artists, and we're looking at one, Jacob Lawrence, were hospitalized for periods of their work. And here Jake spent about a year and a half in a mental institution due to depression. He was overwhelmed being a young African-American artist. And so in the late 1940s, he entered into the institution in Brooklyn, and he stayed there. And it was a place of revival for him. And he practiced his art very, very vigorously, and then came out creating all these new works. Afterwards, his career took off. So Goya, I have three images here of artists painting their doctors. And so here's Goya being treated by his doctor, and you can see the loving embrace that he is being held in. And so he imagined this picture, but he was so close to his doctor, it was a very important part of his acknowledgement of the healing process that they went through together. Vincent van Gogh, Dr. Gachet, a very important and famous part of his life. Dr. Gachet moved him to Arles when things didn't go so well in an earlier institution. And it was in Arles that Van Gogh really began a recovery and began to do well. And he lifted himself and then had the last 5 or 6 years of his great career. The woman who depicts pain and suffering more than anybody I know, or the artist who does that for me, is Frieda Kahlo. She had, in 1 year, 7 back surgeries. She had a terrible accident, which I'll talk about later. And when she got up and finally walked from the back surgeries, this is a portrait of her doctor who got her through all of that. Deities around the world, who's going to take care of me when I get sick? We hope our moms and dads and our family members are, but there are a lot of other people. And the belief in healing is a profound one. So whether you're in Greece or Rome, there were specific deities assigned to do these works. Certainly in the Hindu culture, there's a raft of deities. This is one who are responsible for reaching out and lifting you up, for carrying you in sick. The one that I'm going to show you, this is the great Green Tara, which is over at the DMA. And her sole role is to be a healing deity, to help you in Buddhist terms, to bring compassion and help to you, but also to help you overcome illness. And if you go and see her on the 3rd floor at the museum, one of the marvelous things is to see the way her hands are articulated. Oh, gosh, this is a powerful one. I know he may not, but this is Babolat, and he is responsible in Africa, part of the Yoruba religion, for major illnesses. We're talking about, 10 years ago, he was diagnosed with cancer, and he was the plague kind of illnesses that really killed people and destroy entire villages. So it is, he has a very powerful role, and he dances. A group of the Babalats come out and they dance in a fierce directions, pounding, because they don't have the medicines, so they have to do it with medicines like we do in Western culture. They did it with healing potions and with herbs and certainly ground bones. And so that was supposed to cure you in the early 1900s, but these practices still are carried on today. The Hopi, I know many of you travel up into the Santa Fe and regions, and this particular water drinking girl is also water, very important when you get sick. I can hear Dr. Rosenblatt's voice, drink water. And we forget, and then if you don't drink water, you get dehydrated, which is really a bad idea. And so she has this, I love her festoon headdress. The Healing Saints, this is one of the great Madonnas of Sorrows over at the DMA, and her role is to try to take care of you with the 7 sorrows, with the illnesses that are plague all of us, and to lift you up. Then another whole form of art is the artworks made for healing. So this particular, the Eisenham altarpiece, has anybody seen it, traveled to Europe and seen it? Well, it's hard to see, but it is done by Matthias Grunwald, and it is done, if you look closely, you'll see that there are skin diseases, all pox and all kinds of leeching images on the bodies of Christ when he's coming down from the cross. And this is because this altarpiece was in the cathedral on not a cathedral, but in a monastery where ill people came and they prayed with the monks to try to get healed and get better. And so Grunwald painted the people that were coming here for the healing. So you actually understand what these skin diseases were. And then at the Met, if you've been there, there's this amazing wall as you enter the Asian collections called the Buddha of Healing. And he's sitting in the center in this beautiful red robe, and he's surrounded by his guardians and by many helpers who are all there to help with compassion and to lift you up and to heal your body and spirit. So we're changing now to look at artists, and I'm just going to run through these because I'm already out of time. But we have a whole range of artists over the next 4 weeks that we're going to include. And you'll see these different diseases approached by myself and by the curators and talked about by the physicians. Gogh, which I showed earlier, suffered from a lot of different illnesses, depression, hypochondria, and a stroke that he had. So all of this was documented. And he also spent time in we're having a mental block here, in the sanitariums where the people were in prison, not in prison, but put away when they were mentally ill. Pierre, Auguste Renoir, one of my favorite artists who has a big show opening at the Kimball, had crippling arthritis for the last quarter of his life, last 25 years. And you can see his hands bound as he's trying to paint at the easel. And this amazing picture actually shows him painting that picture, and this particular version is at the Metropolitan Museum. So every morning his hands had to be wrapped by his son or somebody else to hold the brush. And even though he couldn't stand, he eventually got so he couldn't stand, he painted till the day he died. He painted on the day he died. And Henri Toulouse-Lautrec unfortunately had many things, many physical challenges, including falling off a horse as a young boy, and then his bones never grew properly. He also had some osteo diseases, and of course, because of his lifestyle, his alcohol and substance abuse, there was no question. And if you know his works, he painted in the brothels, and so he got syphilis too, which is his own. I did not know what syphilis was. I knew what it was, but I didn't understand what the disease would look like until one of the doctors in the series demonstrated to me, and I went, okay, I get it. I'm not demonstrating it for you. It was pretty, because it attacks your brain, and so your whole body doesn't work anymore. Arie Matisse, of course, many of you know, did beautiful paintings and sculptures, many of which are here at the Nasher and the DMA. And then, unfortunately, he got intestinal cancer, and his wound never healed. And as a result of that, he was confined to his bed or wheelchair from that point after. And he stopped painting. And he started to create what we call paper cutouts. And so here he is dyeing the paper and laying them out and cutting out the individual pieces. So he created a whole new art form, which I think is extraordinary. John Pomara, a great friend of all of ours here in Dallas, and he had cancer, and these are some of the two on the left. The one on the very far right is his cancer cells. Oops, there's Frieda. Okay, well. That one, that John did, which he'll talk about his night, is the murals that he did for the radiation ward over at UT Southwestern, where they do radiation therapy like he had, and they had these huge walls which he created these murals for, so he was very connected with that. Frieda Kahlo, as you know, as I said earlier, who is the artist, I think, who painted the real issues of pain. And she painted all the way through her devastating illnesses and the chronic pain that she suffered. And you see them in these portraits of her. She actually shows you what it felt like. And so to Anna's point earlier, the words, sometimes there are no words to describe what pain is or what suffering is that you're going through. And people look at you and they have no idea what it feels like, none. And she really, I think, captured that terrible experience with pain, but in a way that teaches us how to be compassionate. This amazing picture is her, on the right, is her bedroom. And she did this image of this painting after a lot of turmoil in her life, and she was recovering from the 7 back surgeries. And if you could see on the original, in her actual bedroom, not only above her bed, she had a mirror. And that's how she was able to visualize things, was because she was laying down in the mirror. So she saw her face looking up in the mirror above her bed. And you can see the painting. This is at Frieda's house in Mexico, right in the far corner there. Van Gogh, which I know if I didn't mention, somebody would ask me, isn't Van Gogh in the list? And yes, of course he is. But he painted so many beautiful things, the sunflowers, the great scenes of landscape, and then, of course, when he was in the asylum, he painted the actual experience of being in the asylum. Edvard Munch, who we know well, of course, most people know the wonderful Scream image. The Scream image is kind of the archetype Munch, but it represents a lot of what was going on in his life. And he suffered terrible anxiety and bipolar situations, all of which were diagnosed at that time, and of course, alcoholism. And this is the Margaret McDermott painting over on the newly installed European galleries across the street, which I hope you go see. But it looks like it doesn't look like regular earth. It looks like it's been raw earth ripped away, raw flesh ripped away, and you're experiencing walking through it. And the contrasting colors of, complementary colors of green and red highlight all of that. Willem de Kooning painted most of his life and did amazing sculptures, again, both at the DMA and across and here at the Nasher, and was a prolific painter. You can look at him in his studio and see these beautiful pieces here at our museums. But he got Alzheimer's, and so his very late works become very relaxed and open, and they hardly look like his original works at all. Jackson Pollock, of course, we have the big painting across the street of Jackson Pollock's dream. What is it called? The Portrait of a Dream. So this is him and he suffered from very severe depression and alcoholism. And so you're seeing his portrait of himself, and then you're seeing his brain next beside it, the scrambled images that are expressive images next door. And then Claude Monet, now we're into visual illnesses. Of course, I hope everybody saw the great Monet show at the at the Fort Worth Kimball, and that showed such a beautiful examples of the transition in Monet's life as he went from his blues and pink, lost his eyesight, and then began to come back once he had the cataract surgery much later. So it affected not only his eyesight, but very dramatically his works of art. Chuck Close, a well-known American artist who has dyslexia and talks about it very openly in his work about how the dyslexia impacted him. And also he has, and I can't say that, but the face blindness, how do we say that? Photo. There you go. I knew somebody would know it. Anyhow, and that is why his works, he does these portraits. That's the entire volume of his work are these incredible portraits, which are done down, broken down into little tiny dots. And we'll hear from Stephen Laptisman at the very end of the series. And Stephen is legally blind, but is an artist who creates both sculptures and paintings. So how he does it will be, you have to come to that last lecture and find out. And these are works from his offering. So again, this is really important, just sort of introduce quickly as I can the broad range of illnesses we'll be covering in the 3 upcoming lectures, and also to give you some historical insight and to remind you the power of art medicine, that it is healing both for the patient, it's healing for the artists who create the works. If they're not in many artists have painted just like Homer, the actual suffering of people, and then of course with the physicians. And that's another whole topic which I've fallen into, which is all the physicians who create art and music in their own work. So I'll end with 2 final slides, but I love this slide, that this quote that Renoir gave us, and this is probably one of his most famous paintings, but the pain passes, but the beauty remains. And so no matter how you go through life, that pain and suffering is there, but it will pass, especially if you begin to focus on the beauty of the world around you. As Anna said, and on the back of your brochure, there are 3 upcoming lectures. So I very quickly, because I'm writing them right now, need to know how many of you are coming to the next ones, because then I won't repeat any of it. Okay, about half of you. All right, I got to do better. And there's a wonderful show that's going to be showing at the Dallas Museum of Art in November called Speechless. And Sarah Schlooning has created this show with 6 artists, and they're creating environments, and they've worked with Dan Krawczyk and others at the Center for Brain Health and other places within the university to create these sensory environments so that they're aware of people who have autism and different issues that we have to accommodate in Alzheimer's and so forth and so on, that will be accommodated. And some of the sensory environments are so amazing. So that is something not to miss. It opens November 10th. So with that, I am done. Okay, thanks. Here. Oh, you don't need that, Anna does.
You did it again. Thank you so much. I want to thank Anna and Bonnie for the privilege of joining you this evening. I have 10 minutes to convince you that art and music are helpful in treating our sickest patients in our hospitals. I met Bonnie 2 years ago when she agreed to do a retreat for our residency program at the Art Museum and help us show our residents how the power of observations can actually improve their care of patients. Everybody can get a CAT scan, we can get an ultrasound, we can bypass talking to the patient, but Bonnie showed us that we actually become better doctors if we learn our power of observation. And looking at the art in the museum was a real privilege with someone who knows as much about art and everything that's going on in it. And we all came away just fascinated, but also much better physicians. So thank you for that, Bonnie. Art comes in all different forms. The first thing that you think about is music. Everybody knows that surgeons listen to heavy metal music in the operating room, right? I think it's something that distracts us from the stress that's going on. I know that in Texas, there's a lot of country music that goes on, but as you move further north, the varieties change. And I actually began to use bagpipe music to make my fellows behave in the operating room, because when they got out of control and wanted to do something I didn't want them to do, I just put the bagpipe music on. Everybody feels joy. We all have pleasure. I know Dan's going to talk more about this, but the oxytocin, remember that word. If I ever get down, I go, I need an oxytocin moment, because that's where joy and pleasure come from in your brain. Listening to a favorite piece, seeing a beautiful work of art, looking at colors, all cause oxytocin release. As early as 1930s, Michael DeBakey wrote during his time in Europe that he heard surgeons listening to opera during cases so that they could be less stressed and have a better outcome in their case. And I think that's what we're talking about. In a patient's point of view, having oxytocin and joy and pleasure on board increases the resilience that you have and helps you to overcome and withstand some of the things that are going to take place as you go through your treatment. My first exposure to art in a hospital was actually in 1998 when I visited Kooning, which is a small town on the border of East Germany, in the middle of Germany now. A friend of mine, Professor Torolf Hager, was the chief of surgery at that hospital. He had trained at Erlangen and was considered one of the best surgeons in Europe. He was the head of the hospital, and for those of you who have never been to Kooning, this is a medieval city with a huge castle full of fine art and an artist colony in the town. We were there to learn a new technique. We went to his operating room. He showed us the German method of being efficient and stainless steel and everything. But what I was fascinated by was the art in the halls of the hospital. And I asked him about this. He said, oh, this is something I thought up as I was trying to get the citizens of the village involved in our hospital. So he went to all of the local artists and said, we will put your art on our wall with a price tag. If we sell the art, we will give you the money, but we want to have our patients in a place that has beautiful things in there. It encouraged them to walk, and it encouraged them to think of something other than their illness. And then, as it turns out, he began noticing that the number of people that were coming to the hospital went up. The patients were better taken care of, and they went home sooner. And the reason is that the villagers kept coming to the hospital to see the art and take their families members for walks. They got up, got better, and got out. They came on Sunday. The cafeteria produced a lunch on Sunday that actually brought the villagers in, and they charged less for it. And then they began to make money out of the villagers eating food at the hospital. It's just an incredible story. And I really think that that's what I would like to see for all of our patients in all of our hospitals. I know UT Southwestern has a beautiful new building. I've been to the hospital in Omaha at the University of Nebraska that has a full Chihuly exhibit. Spectacular. And it's because people get better when they see beautiful things. Now, I was a chief of surgery at a small hospital in St. Louis called Barnes-West County. And when I got back from Kooning, I went to him and I said, look, can we do something like this? And We didn't have the art colony that Krawczyk had, but what we did have was a photographer who was willing to go around the hospital taking photographs of all of the staff, all the patients, some of the patients, all of the physicians, and the people that were in the hospital. And I had a floor of 25 beds that were full of surgery patients who were having pain, and they wouldn't really want to get out of bed. And as we started putting people's photos on the walls, they began getting out of bed to go find their nurse's picture or their doctor's picture. And they would take their families to see those pictures, and they're ambulating. We call that ambulation. What they didn't know was that as they went walking, their endorphins, their natural narcotic in their brain, kicked in. They didn't need as much pain medicine. They got better breathing. They didn't get clots in their legs. Their bowels started working faster, and they were getting better faster. So therapy, physical therapy, without physical therapist, walking in the halls in my hospital. I got here 7 years ago as chief of surgery. I found that there was already an arts and medicine program at Baylor. It's in the Salmons Cancer Center, located in what we call the Svetko Center, which is an education, art studio, cooking, music, whatever. But it's stationed there, and they provide different services. And I realized that as people go through surgery, chemotherapy, radiation therapy, that different parts of their brain, besides just their body, get affected. Going back to that art studio and looking at the series of pictures that have been created by patients who have gone through their treatment, whether they've had a complete recovery or whether their disease eventually won, we saw what art was allowing them to express because they couldn't say it to their doctor. It made them want to keep doing what they were doing. And it's a cool picture, or a cool way of understanding what people are going through, how we can do better for them. And the art studio has really helped. Now, if you walk down the hall around 12 o'clock in the afternoon, there's usually somebody sitting right outside Charles Cafe playing an instrument, from the didgeridoo all the way to a keyboard, an organ, violin, guitar, whatever, a harp. Those patients that are coming to that institution are the sickest and are suffering the most because of some of the poison that we give them. It's really nice for them to have something pleasant and refreshing to hear, see, and participate in as they go through that. We get about 500, the musicians in Salmons and in the arts and medicine group get about 500 requests a month for music to come be played in their floor, in their room, or whatever. And I didn't realize how big of a deal that was until I walked into the room of a patient of mine who came from out of town, who had had a big operation, complication, was trying to recover, was having to rely on narcotics, and he was sedated all the time. And I sent one of the keyboardists to go in and play for him. He said that was the best thing that could have happened to him, because as he played for 30 minutes, he forgot about his pain. He forgot why he was there. And I got to tell you, after that, he didn't take any more pain medicine. He pretty much dominated that keyboard for the rest of the time he was in the hospital. But that was all it took. He didn't need any more synthetic pain medicine. Our society has gone overboard for opioids. We're paying the price for having too much pain medicine available. We need something else that will help us cope with what's going on in our medical lives rather than an external narcotic. Art, music, beauty, creativity, painting something that you can remember is a natural thing outside of a illness-ridden hospital is what it takes. So our halls and our surgical wards are now decorated by these coloring wheels. I don't know if my daughters do these adult coloring books. Well, these are big wheels that you can take colored markers and fill in as you're walking. My patients don't like me very much when I tell them that one walk is 6 times around the nursing station. That's a walk. And they're required to do 6 walks a day. I get some real dirty looks, but then they start seeing the color wheels on the floor and they go do that and they do 6 things and they know they've done their walks. It takes their mind off of woe is me. It diverts their focus to illness and pain, to creativity and beauty. Doesn't have to be paintings or music. Doug Lawson, who is a good friend of mine, who was the CEO at the hospital when I arrived, who became the CEO, he was a COO, became the CEO, and has since moved to Houston. When he realized that walking in and seeing white walls, sterility, really bright lights, I'm beginning to feel that right now, but the thing that he wanted to do was bring nature back into our hospital. So he got a huge saltwater aquarium put into the atrium of Roberts. Now we have beautiful fish who bring natural art to our lives, and you can sit and have Tom's barbecue watching the saltwater aquarium and feel like you're not in a hospital. It's key, and I think that's what it's all about. If we don't realize that we have to take care of the other parts of living for our patients, they're going to have a harder time getting better. So beauty, art as medicine, I'm a believer, and I hope that you guys see that for the rest of these series. So thank you very much for the privilege.
My puffer, that's it.
Sorry, I went over.
Hi, my name is Dan Krawczyk. I'm a brain scientist. I'll be handling the brain side of the equation of science and art. Jim was the body side of all of this, and of course medicine. But I think you noticed Jim also mentioned a lot of things like beauty and creativity, things that explicitly are in the realm of the mind. So I'm a basic neuroscience and psychology researcher, meaning I have a Ph.D., meaning I'm not the kind of doctor that helps people. But I'm very interested in the human mind and the human spirit, and I'll share a few thoughts. Thank you, first of all, Anna and Bonnie, for inviting me. It's a real honor to be at the Nasher. And it's very unlikely that I would turn up at a place like the Nasher, but I'm very honored because I started as an art student in high school. I had reasonable technical skill. I could draw quite well. And I was a reasonable painter as far as the tactics of painting. The problem is I didn't have anything to say. So a friend of mine who's an artist, a sculptor actually, had said, good art has to inspire. And you either hate it or you love it. Bad art is mediocre. So in my freshman year of college, when I was considering being an art major, I was painting a seagull, bold stuff, in a bay with some water. And I remember asking my instructor what she thought of it, and she said, I don't mind it. So I had perfectly captured neutral mediocrity. And so I started in psychology and biology, which was much more my speed, and I study reasoning. So I'm interested in the neurosciences in that we have these electrically active cells that govern and influence our behavior. But I'm also interested in sort of the human spirit and what makes us unique. And I think art is very much relevant to that particular perspective. So I study reasoning. That always requires me to say something else. What reasoning means to me, it's very abstract if you simply call it one word. But what I mean by that is taking multiple inputs, perceiving them, and guiding yourself toward one best action for the moment. How we move step by step through a chain of events in order to carry out something unique and something special, and ultimately how we take our old knowledge, combine it with our new knowledge, and form remarkable things. So in some accidental way, I was actually studying art all along in my scientific career. So I have done a lot of brain imaging studies. I've studied analogies. I've studied oxytocin. You can inhale oxytocin that's synthetic and look at how it affects behavior differently. I'm not going to talk about really any of that. I'm going to talk about some very basic brain organization, playing off of what Bonnie talked about earlier with regard to how interested people were throughout history in looking at these disembodied corpses and these interesting parts and how they would add up to a human being. I've brought along a prop, a sculpture, to the Nasher Sculpture Garden. Does anyone recognize this kind of sculpture? It's known as a phrenology head, and it's a historical relic. So this is a head that has a variety of terms listed on it, and it's divided. It looks kind of like a primitive medical diagram. And what this was from is an era in the 1800s when Franz Joseph Gall believed you could feel someone's scalp, and in the bumps and ridges of the skull or head, you could infer what their personality was like. So if you had a very large area above your ear, you had very selfish sentiments, according to this statue. And along the very top of the head is moral and religious sentiments. And some of these are actually quite reasonable, like intuitive reasoning and reflective faculties is right up here in the frontal lobes, kind of where it turns out to be quite important, actually. And then some things are very off the mark, like right in the eyeball, there's the sense of order, which doesn't quite add up. So neuroscience has debunked the vast majority of our friend, the phrenology head, but it took a long time for the methods to come along to really be able to study the brain. If I am a right brain thinker, what's a word what does it say about me? Creative. So I was dismayed when my math teacher in high school said I was probably a right brain thinker. I don't think it was a compliment. So that whole distinction of the right brain being creative and intuitive and artistic and the left brain being calculating and analytical is kind of a pop culture myth. There are differences among the hemispheric processes, but that's a gross oversimplification of personality. And I am going to go back to one of the great neurophysiologists, Joaquin Fuster. So when I went to graduate school at UCLA, I was lucky enough to come along Joaquin's work and see him talk. Fuster was the first physiologist to discover a cellular basis for memory in 1971. And he was doing this with monkeys. So he would probe a monkey with an electrode, and you would have to put it into the monkey's brain and have the monkey do a memory task. And he found that areas of the frontal cortex were active to sustain memory. And at that micro level, just one neuron out of the billions of neurons that are active across the brain that make us human, he was able to discern some remarkable truths about the brain. So I want to pass along Joaquin Fuster's wisdom with this slide. So what we have here, the brain is coded into the back and the front of the brain. So instead of being left brain, right brain thinkers, I think of us as back of the brain, front of the brain thinkers, but we are not one or the other. It's a constant cycle that trades off between what our frontal lobes do and what the back of the brain does. Now, the back of the brain, according to Joaquin, and science has largely bared this out over the years, is about perception, how we take in the world. Our primary touch cortex, our primary auditory cortex, and our primary visual cortex are all coded in blue. In red, the frontal cortex is about action, how we act upon the world, how we plan motor movements and decisions and all of the amazing things that we create. And so what Fuster calls this is the perception-action cycle. which I have listed on this particular slide. And this captures some very deep truths about the brain. So we're constantly perceiving the world around us, and we're very much shaped by that perception. So we're heavily visual. We are heavily influenced by sound, but we also have touch and smell and taste. And those can all be inputs that shape our thinking by the context. Now, when you perceive art and you view art, you are using the back of the brain very heavily. And when you create art, you are acting upon the world. So artists are the sort of frontal lobes of our, they're the frontal lobe leaders. They're creating something that's meant to be perceived by others. And so we learn in this way. We take in information from the world. We build a model within our minds. We then act on the world and have an influence and get to see what happens next. So I think in this process of constantly perceiving and then acting upon the world, that's really poignant about what art is really about. And going back to my very early college self who had nothing to say, I just didn't quite, I was too much frontal lobe. You know, I went on to study the frontal lobes maybe because I was too analytical. I just didn't have enough perception. I wasn't standing back and letting all of the richness of the context drive an action. I was maybe too quick to act. And so I think sometimes as people age or as they respond to diseases, their perception of the world starts to change, and their art will in turn change how they act on the world. And it was occurring to me as we talked about this with Bonnie and Jim, that this is also the key to medicine. So if you think about so much of medical progress, going back to the phrenology head, it was all about perceiving something. I mean, they weren't foolish, right? There was just there wasn't brain imaging or electrical recording to go on. It was simply, let's look, we think the head's involved, let's take the evidence we have back of the brain, and let's act on it. Let's create this map and then try to test hypotheses. And that's a very noble act. I'm very proud to be in science, and I hope to be more in art. I think Bonnie is pulling me more into the art realm, which I welcome. So I look forward to your comments and discussion, and I think we move into more of a discussion format from here. Thank you.
Thank you all so much for your presentations. I'm moderating today. Hello, those of you behind the podium. I often moderate discussions amongst fourth graders, so we'll see how this goes.
Love it, yeah.
So I think maybe, Dr. Krawczyk, maybe we can sort of build on some of what Dr. Fleshman was saying. So you spoke, Dr. Fleshman, a bit about the enhanced resilience that you see in patients and maybe the enhanced ability to cope with pain when they have arts experiences. Dr. Krawczyk, do you have any thoughts about what might be happening in the brain that might lead to those experiences?
I guess I would start out, I would go right back to this idea that perception of the world is so critical to the artistic experience. And certainly when someone is in tremendous pain, that's an amazingly strong sensory input that's unusual, right? So we would not normally have a sort of tactile sense, and then pain is a very specific variant of that. And so it makes sense that it would have an oversized, distorted influence on how you're seeing the world, but it would also, because that's happening, it would enable you to perhaps make connections or see things symbolically and interpret things that you would not otherwise have access to. So this is perhaps why people immerse themselves in sensory deprivation tanks, or sometimes seek out these very thrilling, potentially risky experiences because they want to see the world somewhat differently, and it might offer some type of unique perspective that could then inform your creative process. On the art side, to just speak to the action, the frontal lobe piece of this, I think a lot of therapeutic benefit occurs when we go through this cycling. It's a profound human need to present your experiences to the world. It's not enough to simply experience it. It's like thinking without acting. And you can also act without thinking, which is equally bad. And so this constant balance needs to occur within our brains, and our brains are highly dynamic. And so when something like a profound pain stimulus enters the equation, it is bound to have some reverberating effect, and perhaps by acting on it, telling others about it, expressing it in some way, it reframes it for us, and we start in that cycle of a conversation with the world, which is profoundly therapeutic.
Yeah. Well, there's so much value in those experiences that one has with culture, art, music, things that break you out of that cycle, or break you out of this sort of experience with sickness or pain. What are some ways that hospitals can help stage those interactions between patients and art? You spoke about photography and music. Are there other examples that you all have found meaningful?
So the occupational therapists are not there just to make sure that you can swallow appropriately and do your daily living mechanics. They're there to make sure that you have something that is going to allow you to feel whole. What are the simple, if you've had a massive stroke, what is the simplest thing you can do to express yourself, and how can you actually start doing that on a regular basis to overcome some of the deficits? And there is now, Dan probably knows this better than I do, but if you have trouble speaking, but you can still sing, you can start singing and maybe recover some of your speech, because what maps together works together. And so that's how I think rehabilitation, physical, PM&R, physical medicine and rehabilitation have used those principles to help people recover after traumatic injury, stroke, whatever. In a setting where you now have a change in your body image. Okay, so I'm a colorectal surgeon. I change people's body image all day long. No one wants to come to see me. I can guarantee you. So I would rather just wave and say hello, don't come see me. But as they go forward, there are things people have adjusted clothing to adjust to body image to help, and brightly colored artistic clothing or materials that they use to cover whatever's going on has really been helpful. So I think those are part of that whole mechanism. And I truly believe my daughters have taught me a lot. They'll go get an adult coloring book and sit and color while I'm watching TV. I'm probably doing the most useless thing you can do, and they're actually being productive. So we do that for our patients. We bring them the coloring materials. We'll set them in their room. We'll encourage them to go down the hall. And that's the only thing that's going to get them going, is for someone else to say, this is going to help.
Bonnie, I know that you've done a lot of research with art and medicine. Are there other examples of ways that you can create experiences for people, for patients, that you've seen?
Well, we've touched on a lot of them. One is the physical environment of the hospital, and having artwork up, created by patients, created by artists, but making it, as Dr. Fleshman said, a very beautiful environment makes a big difference. I will say publicly, UT Southwestern has accomplished this much better than our dear colleagues at Baylor, but we hold high that standard, don't we, Cynthia? Courtney's here from UT Southwestern, but Cynthia Krause and I and Susan Sales are working on the physical environment of Baylor, a long Sisyphus-like struggle. But the great thing about Baylor is their patient care. So I think there's kind of a wonderful way in which the people there manifest themselves to be part of the experience, the art experience. The other one is, of course, bringing artists in residence and musicians we've talked about, but also visual artists and art therapists into the patients' rooms, as well as offering classes so that patients and caregivers can drop in. Another area that I'm working a lot in is in medical education. So I train doctors and medical students, especially at UT Southwestern, to look at works of art to enhance their diagnostic skills and their skills at being compassionate and dealing with ambiguity. Looking at works of art, there is usually no right or wrong answer. And so for a physician, they want a right answer because it leads to a good diagnosis. But a lot of times there isn't an easy answer, and the patient manifestations can be challenging. So the training and education at all levels is really important. So in the ideal world, you want to be in a clinical environment, you want to be offering all three.
And Bonnie, I know that you did offer training for Dr. Fleshman's team at Baylor. Dr. Fleshman, do you want to talk a little bit about some of the outcomes from the experience with Bonnie?
So we have a leadership program in the Department of Surgery that incorporates professionalism, integrity, and ethics. We have a psychologist that works with us who teaches us emotional intelligence, empathy, conflict resolution. It's hard to put all of that into context in a hospital that's just full of stress, and you've got one chance to make a right answer, and if you don't make the right answer. So Bonnie really helped us take them out of their environment to realize that observation of not only the artwork, but of each other, and developing communication skills within the setting of a conversation about an illness or a conversation about family that would help the patient decide on goals of life and goals of treatment and whether this is the right next step in their lives. So my residents have remembered what Bonnie taught us, in that you look at things from multiple directions and you see different things each time you change your angle. Mm-hmm. And it's not all focused on one area. If you take the step back, you see what else might be going on. And if you're focused in that triangle, which everything is directing you to see, you've missed what's happening over here. And they remember that, and that was really cool.
Thank you.
Thank you.
Bonnie, did anything surprise you about
Well, the surgeons, it was a scary morning to walk in. 50 surgeons and residents, and they were a grumpy crowd. They were like, what are we doing here? But by the end of the day, they had a great time. And one of my favorite moments was when we were in front of the Henry Moore sculpture at the Dallas Museum of Art on the landing. So it's a mother holding a child, and it's all contorted and out of proportion. And so the objective was walk around, see it from different points of view, and then get into this position. And so we had several volunteers go down on the floor, and everybody's torquing and turning them. And trying to get them to hold the baby up, and there was great debate. Is it a baby? Is it not a baby? And it's a baby. Finally, I revealed the truth. It actually is a baby. But I think that level of interaction pushed them out of their comfort zone and made them realize that each one of them that afternoon who was working on that particular exercise saw things in a different way than the other person sitting right next to them, and they were surprised.
Mm-hmm.
We'll turn it over to the audience in just a moment, but before we do, I had the pleasure of spending a month and a half at Baylor when I was in Venus of Willendorf mode. And to your point, the musicians that would come to the floor were a wonderful way to mark time and to sort of take my mind off of being in that space and perhaps take my mind off of the breakfast that I was served on occasion. The eggs weren't bad. But I wondered if any of you would share a personal experience of your own encounter with maybe having an experience with art when you are in a moment where you need to heal.
I had back surgery when I was 39 years old. My cervical discs exploded while I was going down a ski slope at Snowmass, and I really did not want to be in the hospital. Had I had something to distract me, I probably would not have checked out 24 hours after my surgery. I hate hospitals. And I solemnly swear I am the worst patient you will ever have. It's something else has to happen. And my daughter, who is a designer at a local architect, not an interior decorator, but a designer, had a project to design the ideal hospital room. And I gave her a lot of ideas. So the curved television screen with your vitals on one side, the daily schedule on the other side, and a picture of Snowmass in the winter in the middle. That's what I want. You get out of bed and you walk to the left, and there's a wide door to get to the bathroom. Not a narrow door that you can't get the IV out as you're going through. In the window, where there is a window seat, there is a lounge and a chair and a refrigerator for something to make me feel at home. And we talked about that a lot and why that actually made a huge difference. And I think had I had those things during my hospital stay, I probably would have wanted to stay there. And as it turns out, my wife really wanted me to stay there when I came home. That's what we need. We need some way of making the environment better than it is currently. So.
What a great answer, Jim. Leave it to the doctor to have a perfect answer for this. I have been fortunate with my health that I can't think of a time I've really been hospitalized, but I will share an art experience that is very close to home from just building off what you had said just now. So when I would be sick as a child, I was always lying on this couch, and my parents had this painting of a tree sort of in fall, a very intricate, highly arborized tree in a sunset. And I would just look at this and see all these little features, like a hand in the tree made up of the branches, or a little face of a king with a little crown. And I would see those every time, and I could still go back and pick out those same little details that my mind kind of created in that process. And it probably had a benefit in that it was, when I go back to that memory, it is, I was in the comfort of my home with a mother's care. So I suppose that's sort of along those same lines.
I've spent a lot of time in the hospital over the past decade or more, and one of the most memorable experiences was Dr. Rosenblatt had transferred to Baylor, and I don't know why I was in there. I was in there because I couldn't breathe, and I was coughing. So what Randy always tells me is I have to get up and walk, and that's as close to the most miserable, the 6 laps around the nurse's station. I mean, really, and that was when I realized that we needed to do art changes at Baylor, and so that people would want to get up and walk around. And so there's been a change in the mandalas, or the circles that Dr. Fleshman have gone up. They were on your ward too, have gone up, so that there's at least something that you can contribute to and do something with. I think the other thing at Baylor, which has saved me countless times, has been the music coming into my room. And the reason for that is that exactly what you said, that when the music is played, that my coughing subsides, my breathing improves. I'll often have the text, pulmonary text there, and they're going, oh my God, 20 minutes ago or 2 hours ago when I came in, these were all miserable, but now you're breathing really well. And it had everything to do with the music in the room, which calmed me down and got me into a different mental place. So, and then I would say that although it's not a hospital, it's walking, when I'm sick, in recovery, I'm often here at the Nasher and over at the DMA, because for two reasons. One, it's moving around, but also for me, it's a safe place because I know the people. And what am I moving around to do? To see beautiful things, and I can sometimes just see one or two of them. I don't have to see everything. I can just go sit and really enjoy that and take the detail in that I've never seen before. And I often do that because the DMA collection and the Nasher collections change all the time. You may think you've seen it, but you really haven't. And so I discovered this the amazing collection. So that's another place of healing for me.
Thank you. We'll open it up to questions from the audience, and you'll have to raise your hand high because
we can't see
we're
you.
A little, yes, right here. and please speak up.
Yes, thank you so very much for sharing everything this evening. I'm a painter and a creative coach, and I had my own journey this summer going to UT Southwestern. Thank you very much. I appreciated it very much. Every time I would bring a friend with me, and every time when they would deliver me, we would talk about different work in the radiation, what they thought, or in the morning at 5:30, if I had a CAT scan, I would be so depressed about it, but I would walk the hallways and it would lift me. And I had a very good treatment, and I had radiation every day for 28 days. And I soon discovered that the technicians could hear me, and I would say, Sam, can you change the station to classical music? So Sam knew what station to put on when I came in. And then I discovered that the system was so good that it would play the music really loud. So every single time I would start somewhere with Moonlight Sonata.
Wow.
And it became a transformative experience where I would be taken away completely into a field of the nocturnes or the moonlight. And I knew it was about 4 songs, and it created a sense of trust. I think even though there is not the right left brain area, perhaps there is a strength and there is an intuition that resides in the right brain. If you read Joe Taylor's book, there's a level of trust that it induces. And I became a person that trusted the process. I said, I trust this radiation, and I left. And it was really a very elevating experience right through the whole time. And then one day, as I was leaving, I kept seeing John Pomoro's paintings, and they would always escort me right to my room, right to the dressing room. So I asked the technician, could you please take me down the hall? Because I want to see them. And I had not realized that he was describing cancerous elements blown up. And before you knew it, all the technicians were looking at the art, and they had never paused to look at the artwork. And so the art of the hospital saved me this summer. And it wasn't my own art, but it was someone else's art. And I have a newfound gratitude for artists, past and present, due to that. I really believed it helped me heal.
Cool.
Thank you so much for sharing.
Cindy.
I'd like to ask Bonnie to tell one thing, because Bonnie, I love how the power of art helps you when you're in such a bad place. I love the story that you tell when you're in the hospital for quite a while and you went on a trip.
Oh, this was this was early on. We were in, what was the first hospital, Randy? St. Paul. Yes, St. Paul. I was in St. Paul, and I was not happy being there. And all of a sudden, it was, I don't know, the end of the first week, heading into the second week, and I keep asking Randy every morning, can I go home today? And he says, how do you feel today? Oh, I feel great. I'm going to go home today. And then he'll look at me and say something like, get out of bed, or let me hear you cough. And so, no, I'm not going home that day. So one day I'd had enough of it, and I woke up really, really early in the morning, and I was looking outside thinking, when am I getting out of here? And the answer, so I recognize now that Randy's answers were going to be the same unless I got better. And I wasn't really getting better. And so all of a sudden I decided I wasn't in Baylor Hospital. And I left Baylor Hospital, and I got back on my computer and I emailed all my friends and said, I've left Baylor Hospital, I'm in Venice, and I really love being in Venice, and I want you to send me your poems and your music and your images from Venice. And so most of my friends are art historians and musicians and things like this. So all day long, this message came in, what do you mean you're out of Baylor in Venice? We thought you were still sick. Oh yes, I am still sick, but I'm here creating Venice in my bedroom. And so over the course of the next couple of days, that's what I did. I researched, I listened to the music. Everybody would come in from up and down the hallway because that was what I was doing, was creating my own world in the hospital. And it was a transformative experience. And 3 days later, Randy finally smiled and said, you're going to be going home soon. So, but it had everything to do with the ability to bring the art. And that was really what got me into this whole passionate work that I do now, because that moment transformed my life from being a sick person into being a person who can control her sickness. And it's my brain, what I do with how I deal with my illness is my choice. It's not the illness's choice. And that was transformative for me. So we call it the Venice story. Thank you, Cynthia.
Right
I haven't thought about that in a while.
One back here.
Yes. How are you doing? My name is Brian. I'm a pharmacist and holistic life coach, specializing in functional nutrition and specializing in neuro-linguistic programming. So thank you guys for this awesome panel here. My question to you is more so from the millennial standpoint, and what are we doing on the preventative measures for enhancing people's focus? Because I think a lot of millennials and everyone else, when they're looking at artistic work, how do you hone in on really capturing those thoughts in your mindset and understanding what's going on in your head to begin healing the illnesses that are maybe coming up, or even if you're dealing with a specific illness, how does that work?
I guess I'll
Dan,
take a
we're all-
stab at this. Yeah, from a millennial perspective, I guess I'm sort of out of the age range to where I totally can relate to this. I would say younger people today have grown up with huge amounts of sensory information available all the time, and it's definitely different. And I'll speak to this sort of as a professor who teaches. I have the pleasure of teaching that sort of 18 to 22 year group over time, and it's always been that you try to find little ways to relate to the students. How can you present the information in a way that's going to stick with them because it's relatable? And it gets tougher and tougher, and it's starting to become, we're such a diverse society because there are so many channels available and just across all manner of intake of information, that having that common thread is harder. And that's maybe a generality to say that, but I do feel like it's tougher than ever to relate to these younger people, just because they can't necessarily relate to one another, because they've grown up in a world where you can select your own content, as they say nowadays. So I guess one thing that can be an element of advice is to I guess encourage younger people to pay attention to the arts and art history, because there are works that have stood the test of time, and they will be appreciated, I think, by future generations. And perhaps to Bonnie's point, that it really requires, I think all of us have talked about the need to really study the art and observe it and also take time away. So I think sometimes illnesses can force some reflection, and that can be quite destructive if you don't have something productive to think about. You ruminate, and so it can be a very destructive kind of cycle. So perhaps art is able to fill that need where we can take time to relate to what others have presented, and it's all about that shared human experience. So that's the challenge, I think, for millennials, is that getting the shared human experience out of the visuals is maybe a little bit more challenging, but I think it can be done.
I think there are two real challenges. I obviously am not a millennial, but I teach millennials like Dan does, so it's fascinating to me. And last week I was teaching out at UT Dallas, one of my seminar classes, and I was sharing with them this practice that I have that I developed very specifically out of being sick. And it was after a scan a biopsy came back that said that I had this mysterious organism in my lungs and it wasn't going away. And so I was really not in a happy place. I had just left the museum and I didn't know what I was going to do with my life. And so I literally went to sleep that afternoon and woke up and wrote down a practice to do something new every day. To take an ordinary day and make it extraordinary by meeting new people, going new places. It can be big or little, because I have a lot of days when the big event is getting all the way into the kitchen to get food, or pet my cats, because I'm that out of it. And then it can also be, it can't be medical, and it can't be work, and it cannot carry forward. So I wrote this down on a piece of paper and said, well, that's an interesting idea. Maybe I can do this for 5 days. And today is day 3,022. So I've done it now almost 11 days. Well, thank you, but I didn't lose 20 pounds, and I didn't save 20% of my money. I didn't do a lot of things that I wanted to do along the way, but I did do this. And the exciting thing about this is that it went back to this Venice story, is that I took my illness and forgave myself for the illness, because I can't stop being sick. I am sick. But what I can do is do something that requires me to find joy in my world every single day. And part of that is meeting people and doing things with people, and taking walks is something I love to do, but it's a lot harder on some days than it is on another. But it's those crystal clear moments of experiences that have transformed me. And in talking to the students out at UT Dallas, what was fascinating is one of the things that I've learned. I have 10 discoveries out of this that I've written, that I've come to understand, meditate, be grateful, all of those things. But one of them is living with solitude. And I think a lot of people don't realize that when you're sick, you are often alone. And that that can be, for a person like myself, who tends to be very extroverted and loves to be around people, to be told, no, you can't be around them, or to just need the time to recover, is very isolating. And the silence of solitude is, and that has been written about. Sylvia Plath and others have written about it. But that notion of solitude could be a destructive thing, but it can be turned into a constructive thing. It's learning how to be at ease with yourself, learning how to take pleasure in the small things, learning how to take that time to write notes of gratitude for others. It's about turning that, what could be an isolating, into a positive experience. And so those things, and the students talked a lot about solitude for me, which was surprising, but it had to do more with their life than it had to do with their health. But it was a meeting place that got into a very interesting and complex conversation about the choice to live in life with joy rather than in pain.
I think that's a really inspiring place for us to leave off.
Okay.
I want to thank everyone for coming out on a Wednesday night. We really appreciate you being here. I want to thank all of our panelists for your very thoughtful contributions this evening, and we do hope you'll join us. We don't have a program next week, but we do have one the following week on October 30th. We won't be too spooky, but we'll be talking
about physical illness.
Maybe a little spooky.
Maybe a little spooky.
Maybe a little spooky.
Or gruesome.
Thank you all,
Thank you.
and have a wonderful evening.